And let's do this, America. This is DrMikeSevilla live for Tuesday, August 26, 2014. It is 9 p.m. Eastern Time. And here at Family Medicine Rock's World Headquarters, it feels like 74 degrees. Nice summer day here in northeastern Ohio. This is creating conversations about family medicine, social media, pop culture, life, and whatever comes up. And joining me again this evening, I don't know why, but it's our good pal, Dr. Gerry Tolbert. Gerry, how you doing there this evening, my friend?
Doing well. I don't know what that says about you or about me. If we don't know why we're doing what we're doing, but, yeah.
Starting off, we are celebrating a national holiday. Gerry, what do you got for us?
Yeah, if you take a look at the screen there, you will see my friends Willow and Penny. They are our two dachshunds that we got as as babies. Sorry, I'll cut that off. They are, that way YouTube doesn't censor us. But they are two of the three dogs that we have, and they are good babies.
How many dogs you have? I thought you had more than two.
We have three, yeah. The third dog's not in the picture, and I couldn't find one before the show started because I didn't know prep was on its way.
Prep?
Yeah, exactly.
So how's your week been going there, Gerry? Everybody's been going okay down there?
Yeah, it's been going well.
I hear the dogs in the background already.
Okay, so we're and there's the baby.
If you have to bail during the show, I mean, it's no big deal there. So
we may have a guest star here. Let's see.
There you go. Yeah. She's already stealing the spotlight. So it's good stuff there.
Here, give me this. You can talk to Mike. Say hi, Mike. You tell him hi. Here, listen. You can hear him. Can you hear him?
Hi.
Did you hear him say hi?
Oh.
Did you hear him say hi?
Oh, I'm already scaring kids. Hundreds of miles away. There you go.
She's just easily excitable. She's been at a baby shower with her mama. She just saw the picture of the dogs on the other monitor. So baby shower, no babies yet. We're still waiting on the twins. There's 38 weeks this week, and lots of fun in clinic. But otherwise, yeah, it's been a good week. How have you been?
Well, today we had had a little, I wouldn't call it an accident, but got to the office today, and I saw everybody standing outside, and I was like, oh, I thought there was a fire or something like that was going on, but ended up finding out that there was no electricity at the office today, and the big electric trucks were out there. Ohio Edison was out there, and they were out there for most of the morning and saying, oh, we got nothing. I don't know. So we ended up canceling the whole day, and then I drove past the office this evening and did see lights on there, so hopefully we'll be up and running out there. I know all my patients watch this show, I know, so call the office tomorrow, and we will be happy to see you, so yeah.
Yeah, really hard.
Yeah, I put on my Facebook page, I had a snow day, in quotes, and
nice.
Yeah, because we're completely paperless. Great.
Right.
So I couldn't even look at my notes.
I was gonna say it makes it hard to chart when everything's on the computer.
Exactly. So I just went for a bike ride, and it was a good day. So
nice. The dark underbelly of electronic medical records. No electricity equals no clinic.
Yes, exactly. And I remember when the power went out, probably about 4 or 5 years ago, before we went electronic, and we actually had the paper charts. We were actually able to do some business because we wrote out some prescriptions. We had some paper charts. We had lanterns.
Did they have little gas lamps? So did you have to adjust the wicks on them?
Some of them did, but they were all batteries and stuff. So,
okay.
So there was a huge change versus a few years ago. So
you didn't have to ride your horse into this clinic or yes.
See, she likes the microphone already, so she's already learning how to be a broadcast professional.
Yeah, she's gonna steal it away from me here.
Oh man. So yeah, so that was my day today. So hopefully tomorrow will be a little bit better. Got through another weekend of being on call and going to the hospital, seeing patients, and not a lot of sleep, a lot of phone calls. But hey, just like I said on Twitter and Facebook, I wouldn't want it any other way. I love seeing patients. I love my job. I love my specialty, and was a good time. And thanks for all the encouragement I got from my Facebook and Twitter friends with my little "Let's Do This America" thing, which I always do, which people think is sarcastic. Sometimes it is, depending on how bad of a thing it is. But hey, if you're going to work, you might as well just be happy about it. So that's what I love doing. So hey, you haters out there, forget it. Just get out of here. So. See, this is the challenge of being Gerry, the broadcast professional. He is, she sees herself there, and she's like, hey.
She's actually staring at you. I've got you up on the big screen, and she's waving at you because you waved.
All right, yeah. See, I'm gonna continue waving and say. Oh, yeah, she likes Daddy there. So, let me just kind of shift to our first story here this evening. So, our good friend Dr. Reed Blackwelder, AAFP president, had another cool little Google Hangout with our medical student friends. That was this afternoon, and about 15, 17 minutes. Answered questions about patient-centered medical home. And you can check it out at the AAFP website. They have a nice write-up there. They call this episode "What Medical Students Need to Know About the Patient-Centered Medical Home,"
which was interesting to me, just as a side note.
Yeah. What was interesting? What did you find interesting about it, Gerry?
So it seems like they're going to be poised to, from what I remember of the PCMH, and I apologize for the dogs again. But the ideas are a lot closer to what we talk about in medical school than they are to the stuff that we're seeing in practice, quote unquote, as what is a current practice or a traditional practice these days. It harkens back to some of the stuff that we sort of, at least for me, that I remember growing up on television, being the traditional practice, which was the doctor taking care of people and following them everywhere they went, and being the center of that hub, or being the hub of that wheel of specialties. And it seems like that's the stuff that we're kind of taught about in medical school, even to a certain degree, initially, or at least that we take into medical school with us. So the fact that they're kind of reinforcing that at that level seemed pretty cool.
And yeah, so just to let people what the format was, Dr. Blackwelder had a little bit of I wouldn't say statement, but I guess an opening statement or some opening thoughts. And there was a AAFP student leader there asking a series of questions, which I thought were very good questions. And people can check it out. I mean, there's a nice write-up on the AAFP website. This episode is called "What Medical Students Need to Know About the Patient-Centered Medical Home." It's about 15 to 17 minutes, and there's not an easy URL to find it. But if you go to the AFP website and you search Family Medicine on Air, you should be able to find the episode there. It looks like it's going to be a series of episodes, and I think what they're intending to do is have a series of these to be shown at medical student meetings, the Family Medicine Intergroup meetings, and to kind of start a conversation. Which I think is very cool what they're trying to do. The format is still kind of I mean, they are trying to squeeze in a lot of information in 15 to 20 minutes, and it seemed pretty scripted to me. Would have been nice for them a little bit to engage a little bit more with the camera, and it looks like they were just kind of reading kind of an email. So I mean, it wasn't bad, but certainly it's everybody can do a little bit better with that stuff, and I mean, Gerry, we're one to talk. I mean, we take 45 minutes to cover what they cover in 15 minutes. So people will take this. I wouldn't say criticism, but just feedback. feedback with a little bit of a grain of salt there. So
Agreed. We take 45 minutes to say nothing while they take 15 minutes to say everything.
exactly. So I mean.
Also, as you were talking about easy ways to find it, if you search YouTube for family medicine on air, just spell out all the words, it comes up, and it's actually quite, it's easy to find there. So that's another place you can look. And the older ones show up with it too.
Cool. Yeah. So I don't know how often they're gonna be doing this. I think they said during that video that the next one won't be for another couple months or so. So probably after the Congress of Delegates and all that stuff happened, I believe.
Yeah, it was supposed to be every couple of weeks, and there's a whole FMIG network has its own YouTube channel, just like the your channel, and I have a channel. I don't use it that often, but I have one. And so that if you search for FMIG network, that's another subscription that you could subscribe to that channel. I have no idea what you're saying, sweetie.
Oh man, I'm totally posting this because we just have more people see how Gerry tries to balance all this. This is kind of a how he balances his work life and his technology life and his social media life. So it's fun how he does that. I'm going to shift gears here. So the second story I did want to talk about something that's very cool, also from our friends at the AAFP. They talked about a study entitled It was an article called "Small Primary Care Practices Shine in National Study." And in this study that let me pull it up here let me pull up the article here. This was published in Health Affairs Journal. In this article, it says the authors of Small Primary Care physician practices have low rates of preventable hospital admissions. So they're talking about admissions to the hospital. Found that practices with 1 to 2 physicians had 33% fewer preventable hospital admissions compared to practices with 10 to 19 physicians. Practices with 3 to 9 physicians had 27% fewer admissions. And I think it really just kind of shows that these practices, these offices, that are smaller, that have fewer physicians, they really know their patients better, and they can advise them. They can hopefully see them, in a frequent type fashion, in a convenient type fashion, to prevent people from going into the hospital, being admitted to the hospital, and that's really where things are kind of trending towards, as far as trying to keep people out of the hospital, trying to manage patients in the office setting, because as everybody knows, people that are admitted to the hospital, that drives up medical costs, and the best that we can do to try to keep those patients out of the hospital is to be managed in these small primary care practices, and I encourage people to check this out on the AFP website from August 20th. The title is Small Primary Care Practices Shine in National Study, and I put this on my Facebook and my Twitter page as well, that it's very cool that there is some data out there, Gerry, saying that these small practices really can help not only keep people out of the hospital, but also give pretty good care out there to our patients.
Agreed. That kind of harkens back to what I was talking about, that we talk about in med school, about being that center of this maelstrom, basically the eye of the storm, where things have kind of calmed down and you have the ability to take the information from all sides and really synthesize it to make something that's useful and meaningful, help patients get the care that they need without getting hurt. Please don't chew on my headphone. The other side of that too, though, and the thing that we have to be very careful of is, the downside to these large practices is that you may not be seeing a single primary care physician, so it's not as much like that patient-centered medical home model, and that could be more of the issue than the size of the practice itself. It's just the availability of that primary care, that one person that knows you. And if I come across a patient that I've only seen once or that I don't know well, I'm going to be more likely to overreact sometimes to things that may be relatively innocuous, but it's because I don't know that patient yet and I don't have that information ahead of time. So, being a solo practitioner, essentially, which is what I am, I have to make lots of judgment calls based on small amounts of information or very quickly, and that can go too far the other direction on the small practice side. So, I think both have their I think both have their merits, but if you look at, don't chew on the headphones. No, there's no please to it. You don't get to chew on the headphones. If you look at the numbers, though, I mean, I thought it was interesting. 10 to 19 physicians. That just seems like a whole lot of physicians in one group, and it just seems like that. Again, it's going to be a hard place for you to get to know everybody that you're really taking care of.
And just to let people know, I'm in full-time private practice, and there are a total of 5 family physicians in my group. We have a nurse practitioner as well, we see patients at the hospital, and I'm in a small town here in northeastern Ohio. And so this study really resonated with me, and gave me a little bit of a pride, saying, "Hey, we can take care of patients just as well or even better than your huge multi-specialty groups out there. So take that, you big groups of physician people."
And we keep them out of the hospital better, which is a big deal.
Exactly.
Because the hospital is the worst place to be if you're sick. Because that's where all the sick people are.
That's right. I try to stay out of there, but I work there, so it's kind of
it's hard. It's hard to stay away. But it's we say it jokingly a lot, but it's true. I mean, and especially for folks that have that may have that may be going in for something relatively innocuous, but that needs observation or inpatient care. They go in and they end up contracting another infection while they're there, or they're exposed to something that they normally wouldn't be, or it's not an innocuous place. And so if we can keep people that don't have to be there out of the hospital, that's a big deal. So the study really does show that that's a huge benefit to being in those smaller groups.
So we're going to talk about it in a little bit here. I'm going to tease this a little bit, but we're going to talk about, there's been a lot of press this week about e-cigarettes and the impact of that to patients, to youth. But before that, I did want to mention something that I'm going to be going to a conference next week. Not the whole week, but it'll be at the end of next week. It's going to be after the Labor Day holiday. And if you've been paying attention to my streams, especially YouTube, I've been interviewing people going into the Stanford Medicine X meeting at Stanford University. It's going to be September 5 to 7 at Stanford, medicinex.stanford.edu. And I've been interviewing people going into this, just trying to talk to them, and a lot of them are my friends. So tomorrow night on Wednesday, August 27th, Dr. Brian Varder-Beating will be here. Dr. V on Twitter. It'll be 8 p.m. Eastern time, and I've known him for a number of years. So we'll be talking about just the kind of what our opinions on physician social media, what we think is going on. We'll talk about his blog, 33charts.com. Please check that out. And he may have a surprise for us. So for people out there who like Dr. V, come back here tomorrow night, 8 p.m. Eastern time. And
my interest is piqued.
We'll be talking about Medicine X. We'll be talking about 33 charts. We'll be talking about maybe something else.
It sounds like a really good time, Mike. Can you tell me a little bit more about that?
And thanks to everybody who watched my other 2 interviews with my good friends Meredith Gould and also Chris Snyder. And I've been a blogger slacker, website slacker. I have to put all these in a blog post and put it out there for all of you to review going into the Stanford meeting next week. So I'm very excited about that, and I'm getting back into this interview thing, and I'm going to be interviewing people on video as opposed to audio in the past. So that's going to be very exciting to do that.
Got another interview coming up Thursday too, correct?
Yes, that's right. So thank you for that, my friend. Our friend.
Anytime, Mike. Anytime.
Our friend Dr. New will be here. Ryan Newhoffel. He is did one of the direct primary care gurus out there, and I do have a YouTube video interview that I have. You can check it on my YouTube site, MikeSevilla.tv. That gets you right to my YouTube site, and so he'll be here at 2 p.m. Eastern, 1 p.m. Central. And we'll be talking about his experience at the AAFP resident student meeting, and also the latest on primary care, direct primary care, and just how life is with Dr. New. So he'll be here 2 days from now on Thursday, August 28th. So big interview week this week. Of course, kicked off with our good friend Gerry, and so yeah. But before we talk about e-cigarettes, I do want to just again just talk about a couple of AAFP things. Of course, we're leading up to the big AFP annual meeting, the Assembly and Congress of Delegates. It is in late October, October 21 through 25. The hashtag is AFP. The hashtag is hashtag AFP 2014. And there's going to be a lot of stuff that's going to be talked about there, including Family Medicine for America's Health, that is also known as Future Family Medicine 2.0. And I'm hoping through September and October we'll be getting more of our friends on here talking about the meeting, talking about their excitement for the meeting, and how much trouble we're going to be getting into in Washington, D.C., talking about that there. So
I, on the other hand, will be changing diapers and taking care of 3 younglings under 3, so I will not be there, but I will be paying attention to all the things that are coming out via social media as well as through some on-the-scene reporting.
Yes, Gerry will be holding the fort for our social media headquarters, where he's at. Maybe, I don't know. Hopefully. Hopefully we'll give him a little break from all of his child care duties, which I know he's going to love to do, but just to vary things up, we'll have him on the live stream.
It's always a good thing to have a little variety in your life.
Gerry, is that your NPR? Are you trying your NPR voice?
I am, Mike. Thank you for asking.
Okay. We really need to do rehearsal sometimes. I don't know. The last AFP plug I'm going to do is, of course, in the spring, 2015. It's going to be awesome. April 30th to May 2.
Coming to a galaxy near you.
That's right. NCSC 2.0 or 3.0 or 4.0 or whatever it is now.
The next NCSC.
That's right.
The next generation of NCSC, if you will.
That's right. So, it says the National Conference of Constituency Leaders, hashtag AFPNCCL. You can also check that out at afp.org/leader. And we will be talking about that as well as the days and months go on.
Time is flying by here, Mike. We've got to get our stuff together.
All right, so let's talk about e-cigarettes. So e-cigarettes, there's been a lot of articles this week, and Gerry, I know you have been reading a lot of them. And why don't you kick this off here? What have you been reading this week?
A couple of small blurb type articles. The first big one was early this week, the American Heart Association came out with the actual policy statement on e-cigarettes. I thought it was interesting to note that they do the thing that the media have been running with is they said, e-cigarettes are a better alternative to traditional tobacco-based cigarettes. But if you really look at the statement, the stance that they took was if you have to have some intake of nicotine, that the e-cigarette is a better alternative to a traditional tobacco-based cigarette. It is way better to not take in any nicotine at all. And nicotine is a drug just like any other, like caffeine or alcohol or any of the other things that we take in. And so that the concern is, is there a safe level of consumption? Maybe. Is there a dangerous level of consumption? Definitely. And knowing what that is for each individual may be difficult.
Ooh. And I direct people to there's an article from the AP from August 25th. The title is E-Cigarettes May Help Smokers Quit. The American Heart Association's first policy statement on electronic cigarettes backs them as a last resort to help smokers quit, as Gerry said. The American Cancer Society has no formal policy, but quietly took a similar stance in May.
And then today, the WHO, there was a big article, or several big articles, that were talking about how they just basically came out and said, nah, just ban them. They're not good, and we need to get rid of them completely.
Yeah, I read an article in the Telegraph. The title is Ban E-Cigarettes Indoors Due to Passive Vaping Threat, says the World Health Organization. E-cigarettes should be banned indoors over fears that they can be as toxic to bystanders as normal cigarettes, the World Health Organization said. So, and then there's another article that I'll quote here from the CDC. This article states, electronic cigarettes may be more tempting to non-smoking youths or utes than conventional cigarettes, and once young people have tried e-cigarettes, they are more inclined to give regular cigarettes a try, U.S. researchers said on Monday. A report released by a team from the CDC, or the U.S. Centers for Disease Control and Prevention, lends evidence to the argument that electronic cigarettes encourage youth smoking. Well, I mean, even real cigarettes encourage youth smoking.
You know who doesn't encourage youth smoking? Smokey the Bear, because only you can prevent forest fires. Yes, right. Only you can prevent forest fires. Anyway, all joking aside, they made some good points, and the WHO made some good points. Why are you marketing things like bubblegum flavored, nicotine vapor? And we'll talk about vaping, the word, here in a second. But why are you marketing bubblegum flavors and these things that are going to be really targeted at younger, teenagers, basically? Excuse me. Why would you even do that? What's the point? And I understand that even adults like bubblegum and chocolate and those types of things, but really the marketing is geared towards kids, and it's all about money at that point.
Big shout out to the two people that are watching us live. Well, actually, they're not impacted to one person. So thank you out there. We love you.
Didn't mean to scare them off.
Well, we're trying to build an audience here, Gerry. We're trying to
like robots, Did you see the Korean baseball team that they were so bad that they had to put robots in the stands? And
nice.
So back to a point I was making earlier. The word vaping, we need to get away from that as well. Even though it's not a cool word, it's way cooler than inhaling nicotine vapor, which that's I know that's a lot of syllables, but if we come up with a gimmicky name for it, that's giving it power, and we don't need to give it any more power than it already has.
You mean marketers didn't come up with that to sell more product? I can't believe that.
Man, no, they would have never done that.
No, not at all. But I mean, I have had I've had some patients talk to me about electronic cigarettes.
Same here.
Mainly adults who are smoking 4 and 5 packs a day, and they say, "Doc, I've tried it all. I've tried the patch, and I've tried the pills and Chantix and the gum and this and that, and which is kind of what they're saying is as a last resort type of thing. And like anything else, I mean, I think there is some data out there that any kind of nicotine supplement is like 20 or 30% success. So for electronic cigarettes, sure, why not? But I do agree that for the youths or the ute, the electronic cigarette can be.
What's a ute?
Be portrayed as kind of cool because it is digital, it is electronic, it can encourage nicotine use. So.
Yeah. So here's the thing though. Calling it email doesn't encourage them to send letters to their grandma. So calling it an e-cigarette doesn't. I mean, it's hip. It's with it. It's that whole whatever the kids are saying these days. But my biggest concern is by far that they're not really addressing, and the WHO did a better job of addressing this, but AHA they buried the lead on the stories for some of these. That AHA really is saying Nicotine's not good for you. It can have some heart effects. It can have some other effects on the nervous system that are not good in large volumes. And so that needs to be the point I think that we're emphasizing. And I think there's this whether it's because of marketing or because they don't want to make people mad or they just want to get page views, there are a whole lot of people that aren't talking about that aspect of things.
Yes, exactly. But this is kind of the beginning or the middle of the electronic cigarettes debate, and I've seen a lot of the paraphernalia, vaping paraphernalia, that are out there, and I mean, Gerry, it can get pretty extravagant, and I've seen some of the stuff out there, and there's a lot of stuff on YouTube about people trying different flavored, type of vaping and it's a whole industry now.
Yeah, purchasing all of that stuff and looking at all of those different, what are the things that they're able to use to consume their nicotine, and how do they look the coolest doing it, which is still kind of goofy to me. But I don't know. Have you ever been on a plane with somebody that's has been vaping? They smell almost. It's not as much of a tobacco burnt smell, but it still can be an odd smell for some of those things too. The only thing I think of when I see them is, hold on, let me share my screen here. You're not going to get audio, but
wait for it.
See the video. Give me just a second here. I gotta
wait for it.
Okay, there we go. Play with some buttons. Okay, all right, here it comes. Share. There it is. That's what I think of every time I see somebody vaping. Our buddy Jabba the Hutt. Oh. Ni Jabba no bada. Diwana wanga.
Hey, a big shout out to the 2 or 3 people that are watching us live again. They probably came back, and then they probably left with the Jabba reference. But hey, thanks for...
Watch it. Jabba the Hutt's cool.
I think I'm starting a fight with the co-host. This is awesome. Oh, this is good stuff. So yeah, Jabba. Jared, what would Jabba the Hutt sound like on NPR? What would that sound like?
Diwana wanga.
You're listening to NPR.
Ni Jabba no bada.
Oh my gosh. Yeah, this is great. So before our last story, I did want to kind of just button it up on this ice bucket challenge thing. It's everywhere, and now it's nowhere. It was all over Facebook when we talked about it a couple weeks ago, and we were one of the first people to cover it. Not really.
No.
But I want to feel like that we are. So I think right after our broadcast, that's when the backlash really started, and so it's not. It's kind of yesterday.
Yeah, although right after our broadcast was when I found the video of that, and you may have seen that when I shared it. There was a gentleman who actually his mom has ALS. He was diagnosed with ALS, and he put up his ice bucket challenge, and it started out kind of goofy. It was him, in a bikini dancing around on a car, but it finished with this sort of heartfelt message about how ALS is this really, really debilitating disease, and it basically, for lack of a better way to put it, sucks. And so his statement about, this is what we need to be looking at, is this is what we're trying to fight, this is why we're doing this is the focus. That brought back some of the real reasoning behind the challenge to begin with, and so that actually made a difference right after we kind of wrapped, and I've kind of defended him a little bit. I've been the pro versus the con here, but yeah, no, it's I think, like I said the last time, it's just about making sure that there's a focus on what's important about that message and not just the message itself. We can a lot of times lose the real underlying message in the fun of doing whatever it is itself. They're movie stars and authors and television personalities, and of course all of our friends and family that were doing these videos, but to see why they're doing it, to see what they're doing, and to really emphasize that this is, what we're really trying to do is come together as a global community and raise awareness and raise money specifically for research into getting rid of, or at least treating, this horrific disease.
And just to take a little bit of a different angle on that, I've read a lot too about what does it mean? What does it mean for social media interaction? What does it mean for philanthropy? What does it mean for advocacy in general? And is this a new way for fundraising? Is this a new way for philanthropy? Is this a new way for advocacy to try to get your message out? Is to have some kind of message and then challenge your Facebook friends or to challenge your friends on social media to try to get out the basic message and maybe to do something silly and to donate something to a very worthy cause. Is this a new way, a new wave of how to get a message out, how to advocate, how to fundraise, or is this just kind of a flash in the pan and nothing like this will ever happen again? It's be interesting to see how charities and organizations and advocacy groups and people like you and me try to share our story, especially when it comes to family medicine and the FM revolution and what we want to try to do out there on social media. So it can be kind of seen. There's going to be a backlash for a little bit. People are going to try to tag onto this and say, what's the next ice bucket challenge? Which I don't think there'll be a next ice bucket challenge, but maybe from a smaller scope standpoint, there's going to be some advocacy steps out there to try to capitalize on not what they're doing, but kind of the structure and the format, and to see how they can spread their message.
I agree, and I think that the one thing that you have to keep in mind is that there have already been attempts at copycats, but it's no different than, ask the question, how do you make a viral video? Well, you make a video and then people like it. I mean, there's not, this didn't go viral because it went viral for multiple reasons, and that idea of something that reaches sort of critical mass and reaches enough people and goes to the hubs, and we could Malcolm Gladwell this all day long, but the bottom line is it's effective for what it is this time around, and just like you said, just watching to see how people react to that and how it changes the dynamic and the how disruptive it really is, to borrow another lovely $8 term.
Yes, we're all about
disruption.
What would disruption sound like on NPR, Gerry?
Well, that really depends, Mike. Most of the time, a disruption is not a good thing, but in most business circles, disruption can actually cause innovation, and that is a very good thing.
Okay, so that was the awkward pause. I thought that was kind of funny.
No, that was good. I enjoyed that. I was actually waiting for you to come back with some type of response, such as, I don't think so, Gerry. No. A big shout out to our friend Sarah out there, who gave my
us
wife?
a link. No, Sarah Nozel.
Hi, Sarah.
Sarah Nozel. Yeah, she gave us a little shout out and share on Facebook, and we'll be contacting you.
Thanks, Sarah.
To come on and talk with us if you dare, or if you want to.
If you dare.
No, actually, we shouldn't be doing it. We should. No, we should be like begging her to come on. Like, please come on and talk to us about.
It would be a good thing.
I think Gerry. I think it would be fun if Sarah came on and
I
talked
agree.
about.
I agree. I think Sarah needs to come on and talk about all of the wonderful things that she does, because of the wonderful things she does.
I think so. Now that we've creeped her out, we'll move to our last story here, which is always a fun story because we have to end on a high note.
You said hi.
No, this has nothing to do with. Well, I guess Starbucks could be medicinal.
Vaping. Yeah, see, we're coming full circle here. Yeah.
Maybe it could be. This is from our friends at the Associated Press, dated August 21, and it's dated 378 people pay it forward in Florida Starbucks. This is from St. Petersburg. A woman started an act of kindness chain that lasted for hours through a Starbucks drive-thru in Florida. She ordered an iced coffee at 7 a.m. Wednesday in St. Petersburg and asked to pay for the caramel macchiato for the stranger in the car behind her. He returned the favor. The chain kept going. The Tampa Bay Times reported that the chain finally ended around 6 p.m. when customer 379 pulled up and ordered a regular coffee. This guy leaned out the window, explained the chain started earlier today, and asked if she'd like to participate. She declined, saying she only wanted to pay for her coffee. What is wrong with that person, Gerry?
I'm kind of surprised it didn't happen before then, but it's heartwarming to hear that it lasted that long.
Yeah, and I've seen that. I mean, it's kind of cool to do that sometimes. I mean,
Sure.
not just that, but I mean, just some random act of kindness. And
The funniest one, I didn't. This is not me blowing my own horn. This is me just telling a funny story because I thought it was hilarious when it happened. I actually was at a Chick-fil-A the other morning. This has been, actually, it was like 2 weeks ago. I did that. I said, okay, I'm just going to pay for the car behind me. Just go ahead and put them on my tab there. So paid for them, went out, and as I was getting ready to pull away, I realized that I had totally forgotten to get my daughter's food. I'd gotten food for my wife and I, but I didn't have any food for my daughter. So I got back in line. Well, I got back up to the window, and the guy's like, so that person in front of you just paid for yours, so technically you've come all the way around full circle here. So you just ended the chain, and there's nobody behind you. I was like, okay. So I paid for the timer, but then I ended up getting free food on the back end. So it was kind of like the most self-serving, nice thing to do in the world. I was like, man, I was trying to do something nice, and now it turns into something for me, and now I look selfish, and this is just, it's like I think the guy in the drive-thru thought I had driven around on purpose just to see how long it would go, or if anybody was going to pay it forward, because he just kind of looked at me funny. But
I can't believe that you did that, Gerry. I think you did that on purpose.
I promise it wasn't on purpose. It was not a planned event. It was something that just happened spontaneously. And you know me, I'm a very spontaneous person.
For people tuning in late, we're trying out our NPR voices to see.
We're really trying to see if there may be a way to integrate Pete Schweddy into our next show.
Exactly. And for people who hung in to the end of the show, this is what we're trying to do. Big shout out to our good friend T-Rave, who's watching live, and we haven't seen him for a long time. He's awesome. He's a very nice guy, Gerry. I think he would.
That's a good thing. It's a good thing.
I think it's a good thing.
I'm mixing NPR and Martha Stewart, but it's because I don't know any other good taglines that sound good in that voice.
We're up to 5 live viewers. So this is great. And if you're listening and you want to give us a shout out on Twitter or Facebook, or anything else,
you could maybe find something way more constructive to do with your time. No, I'm just joking. We really do enjoy having actual people watching with skin on.
Exactly. So just to let people know that Gerry and I will be doing this through September and October, and probably after that. So please pay attention, because I'll be tweeting this out on my Twitter, and if we're friends on Facebook. Please give us feedback, because Gerry and I would do this if there was nobody here, and we have. But we really appreciate all of you out there, watching live and also on the archive, on demand. We're on demand, Gerry.
We are on demand. I don't know how much demand there really is, but we're there. The other side of that too is we've batted this around of whether or not to turn this into an actual podcast as well, and just capture the audio and put that up somewhere. This has been these last few weeks have been sort of a beta test to see how the equipment works and how the program works, and to come up with a format. And I think we finally started lining things out pretty well. We've got the 3-story format with a couple of breaks in the middle is working out pretty well. But if people have ideas about other things, or if they think one of those stories every week needs to be about my dogs or whatever, which please, if you say that, I might have to worry about your health. But if you have ideas for one of those segments, or if you think that we do a good job talking about one thing or another, please let us know, because that gives us kind of a direction to go. So if you are paying attention and you have concerns or questions or comments or whatever, please get them to us through Twitter or Facebook, whatever.
And, I'm going to be calling out some of my friends, especially in the Family Medicine Resolution.
It's a Family Medicine Revolution challenge instead of an ice bucket challenge.
That's right. And even people outside of that, my good friend T-Rav, I haven't talked to in a long time. Maybe we can get him on here. Our good friend Dr. Jonathan, who we haven't talked to in a long time. We should get him on here just to talk about whatever he wants to talk about. And, driving the conversation there, Gerry, just talking with people and entertaining them and informing them at the same time.
So driving in cars with family medicine doctors. Oh wait, no, that's taken too. Well, man, what are we gonna call this? We got to come up with a name. That's the other thing. If you have suggestions for a name, let us know.
Oh yeah, and we didn't get to go to the soundboard a lot tonight, but we have sound effects. We have songs that hopefully won't get us banned on YouTube.
Yeah, I think it's. We apparently need a laugh track as well, according to Sarah, which I think is a good idea. I've been playing with that actually and looking at different ways to create that, whether that's us laughing ourselves, which I think would be even creepier, but I think the other option would be to have the canned laughter like they had in the 80s sitcoms.
Well, I mean, we're getting feedback from our good friend Dr. Sarah. She says, I think you guys need a laugh track and some creepy sounds at the opportune moments, like at the awkward pause moment. So
yeah, we could have some crickets or something like that. I think that would be fun.
Exactly.
So, with gadgets, one thing I didn't mention, and we kind of talked about this before the show, but as far to wrap up on the gadget side of things, because I was thinking about ways that I could trigger the sounds with my watch, because I have a Pebble, and you can do fun stuff with it. But and some of you may notice that I'm not a pirate tonight. I'm not sporting the Google Glass, not because I don't like it, or because I've had a falling out with it, or because it's left me for a better face. Apparently there's an issue with there's a little piece of foil on the prism that allows me to see the screen that it's projecting, and that little piece of foil doesn't respond very well to moisture apparently, and mine, it's been very humid here lately, and so mine actually started bubbling up and made the screen difficult to read. So the folks at Google, and this is not a commercial for them by any stretch, but it's definitely something that's really cool. They are replacing it because it's one of those things they can't just slap a sticker on it and make it better. I thought that might have been what we did with it, but they're going to replace the whole unit, and they no questions asked. I mean, there were questions, but nothing that was unreasonable. But they're going to replace it at no cost, and it should be on its way. It should be here tomorrow even. But it was a neat way to see them in action. That whole idea of do good or be nice, or however you want to phrase it. They've said it several different ways, but I thought that was kind of cool. So shout out to them.
Cool. I think that's all we have for us tonight. We're 48 minutes, so we exceeded our goal.
But we had 5 people watching us at one time.
That's right. We're yes. So we're building our audience, and all of you out there can say you just got it on the ground floor because there you go. So before we go tonight, so Gerry, do you have anything else for us in your best NPR voice?
Be sure to tune in next week when we talk about clowns, the Cat in the Hat, and a small number of fish that we have put into a small glass jar and covered with metal beads. Thanks. And
okay, so so thanks everybody who joined us live. All you people out there, really appreciate it. Please make fun of us. Please draw attention to us because any press is fine. For me, DrMikeSevilla.com, DrMikeSevilla on Twitter, and you can make fun of me in any of those type of ways. And so we're leading up to the big DC meeting for our friends at the AFP. So next week is September. I told Gerry it's December next week. It's actually September next week.
I did know the difference, though. It wasn't that I just took him at his word for that. So I didn't even have to look it up.
That's right. Trust but verify.
That's right.
That's all I'm saying. So that's all I have for you this evening, kids. So thanks all of you out there for joining me and joining us, me and Gerry.
Yeah. Joining me.
Joining us. Well, we're gonna have a really awkward post-show meeting. Wish I could record that for all of you. So that's it. This is Dr. Mike Sevilla reminding you that family medicine rocks. Good night, everybody.
Good.